My name is Dr. Chris Kager, a neurosurgeon at Lancaster NeuroScience and Spine Associates. I performed my undergraduate and medical school training at the University of Pennsylvania in Philadelphia, PA. Following that, I performed my neurosurgical residency at the University of Cincinnati and Mayfield Clinic in Cincinnati, Ohio. Following that, I performed a one-year complex spine fellowship at the Cleveland Clinic under both neurosurgery and orthopedic spine surgery. I've been in practice at Lancaster NeuroScience and Spine Associates since August of 2001. Following my neurosurgical training, my wife and I were looking to get back to the East Coast. My wife grew up and still has family in Chester County. We really enjoyed the Lancaster area, and it was close to her family. In particular, the practice here at Lancaster NeuroScience and Spine was very attractive to me. The partners that I work with provide comprehensive care in all aspects of neurosurgery, and the community provides an excellent place for raising a family. In general, I find the medical community extremely skilled in Lancaster. I think that being close to Philadelphia and Baltimore and other cities provides a major source for medical training, and I think you see that in the medical professionals in Lancaster. We have a very strong relationship with all medical specialties, including the trauma services at the local hospitals as well. Even from a very young child, I can remember being interested in science and being fascinated in how things in the body worked. In particular, how the brain functioned was always very fascinating to me. In college, I was actually a neuroscience major, which provided a natural segue into my current position. Due to my extended training in spine fellowship, I tend to focus more on complex spinal problems, such as cervical and lumbar disc problems, including artificial disc replacement and fusions, as well as brain and spinal tumors. I think the most rewarding aspect of my work is to see patients actually get better and provide them with a more full life as they recover from their neurosurgical problems. I try to focus on the whole patient rather than just the particular problem at hand. We always must consider how the problem affects the patient and their ability to function and enjoy life fully. As a neurosurgeon, one thing that's clear is that no two patients are the same. There was one particular case when I was on call and called to the emergency room to see a woman presenting with increasing lower back pain, which is a very common complaint to our office. However, in talking with her and examining her, it was apparent that there was something more going on. And in fact, she was dealing with a spinal tumor that she did not know existed. And she required emergency surgery to help her in that particular case. One piece of advice I have for many of my patients, particularly with spinal problems, is to stay active. It's amazing what that does for both their physical and mental well-being. Many times we'll develop a particular individualized program for them based upon what their problem may be. Some of the things that keep me active are sports of all sorts. I personally run and play tennis. We have 6 children that are very active in all sorts of sports, and I coach football and lacrosse, and my children participate also in tennis, soccer, and swimming. As a neurosurgeon and a father of 6 children, I'm also concerned about preventing neurologic injuries in children. I volunteer my time as a physician leader for F.A.C.S in Lancaster County, which is a head and spine injury prevention program focusing on having kids wear helmets and also avoiding participating in risky behaviors.